Hello, good afternoon. My name is Maite Luján, and with my classmate Mariana Morales, we're talking about a clinical case summary that is a complicated diabetic food with infection. In the contents of these presentations, we're talking about the patient information, medical history, present illness, physical exams, labs and imaging, diagnosis, management plan, and conclusion. Patient information: name Sergio Luján Flores, age 46 years, date of birth December 3, 1978, sex male, marital status single, nationality Mexican, place of birth Delicias, Chihuahua, address 1409 South 12 and a half Street. Phone number 639110638. Occupation employed. Religion Catholic. Medical history: type 2 diabetes mellitus poorly managed, no recent glucose checks, non-adherent to oral medication, ex-smoker, sedentary lifestyle, diet rich in carbohydrates, mother with diabetes mellitus 2 related complications. In the present illness, he is a 42-year-old male with a 12-year history of type 2 diabetes mellitus. Poorly controlled, he presented with a 10 days history of a progressive worsening ulcerative lesion that began on the fifth toe in the left foot. And the patient initially noticed a burning sensation and redness, which evolved into a necrotic purulent ulcer. He presents a foul odor, local swelling, and fever. Physical exam: febrile and in mild distress, ulcerative necrotic lesion on fifth tooth with extension toward the hallux, purulent discharge, erythema and edema across the lateral to medial forefoot, diminished peripheral pulse, neuropathy signs, reduced sensation and reflexes. In labs and imaging, we can find in labs white blood cells, 15,400 microliter deciliter, in glucose, 286 milligrams per deciliter, no radiologic evidence of osteomyelitis, and wound cultura was pending. Diagnosis: infected diabetic foot ulcer Wagner gut 3, extension from the fifth tooth to hallux, raising concern for compartment involvement, uncontrolled type 2 diabetes mellitus, neuropathy. In the management plan, we can do hospitalization IV piperacillin with tazobactam, basal bolus insulin regimen, urgent surgical disfibrilment, vascular endocrine and nutrition consults, and the patient education on food care and lifestyle change. Conclusion: this case highlights a typical but severe presentation of diabetic foot infection originating in the lateral tooth, a 5-digit and progressing medially toward the hallux, potentially compromising fire foot, vascular integrity. Early multidisciplinary intervention is essential to prevent amputation and preserve function. And that's all for us. Thank you for your attention.